Welcome to Zen Lens Scleral Lens Training and Certification. After this presentation, there will be 7 brief questions. Once you answer the questions correctly, you will be on your path to fitting and ordering Zen Lens Scleral lenses for your patients. Scleral lenses are historically known for visually rehabilitating irregular corneas, and Zen Lens Scleral Lens is no different. Zen Lens can be used for patients with keratoconus or other naturally occurring ectasias like keratoglobus and pellucid marginal degeneration. Zen Lens also can be used in patients who have suffered irregular astigmatism from surgery like radial keratotomy, LASIK ectasia, and after corneal transplants. Additionally, Zen Lens can be used in patients with a history of corneal degenerations like Salzmann's or Terrien's, as well as corneal scars. In addition to the irregular cornea, patients with ocular surface disease can benefit from scleral lenses. The cornea is submerged in saline during scleral lens wear, and this can help patients' symptoms with severe dry eye syndrome, including keratoconjunctivitis sicca, graft versus host disease, and Sjogren's disease. Scleral lenses have been used for patients with limbal stem cell deficiencies, neurotrophic disorders, and cases of exposure keratitis. The Zen Lens Scleral Lens diagnostic set is quite versatile. It was designed with 2 diameters, 16.0 and 17.0 millimeters, to accommodate a variety of corneal diameters. Also, there are 2 shape profiles, prolate and oblate. These shapes more closely match the different corneal topographies. Lastly, there are 4 additional lenses of each shape and diameter with toric peripheral curves. Here is the diagnostic set configuration. The top 2 rows have the prolate shape, whereas the bottom 2 rows have the oblate shape. Each row corresponds to either a 16 or 17 millimeter diameter. Each diagnostic lens has a center thickness of 350 microns, and the sagittal height difference between each lens is 300 microns. The lenses in the last column have toric peripheries, or toric PCs. All of the parameters in this column are identical to the column starting with Z5. The only difference is that instead of the standard advanced peripheral system or landing zone, the toric PC diagnostic lenses have peripheral curves of flat 3 in one meridian and steep 3 in the other meridian, for a total of 180 microns difference between the flat and steep edge. In addition to the flexibility of the diagnostic set having 2 diameters, 16 and 17 millimeters, and 2 shapes, prolate and oblate, there are other unique features which will be described further in detail. These include the ability to adjust all fitting parameters in microns, the smart curve technology that allows isolated parameter changes, as well as a wide landing zone. As stated earlier, the Zen Lens Scleral Lens has 2 shapes, prolate and oblate. The prolate lens is shown here, where the center is steep and the periphery is flat. Conversely, the oblate is flat in the center and steep in the periphery like a reverse geometry lens. Demonstrated here are 2 lenses with the same sagittal height, but with different shapes. As you can see, both lenses share the same advanced peripheral system or landing zone, as well as the same limbal clearance curve. The differences between the prolate and oblate shape occur over the mid-peripheral cornea. This is the basic profile of a Zen Lens scleral lens. The zones centrally outward are the base curve, smart curve, limbal clearance curve, and advanced peripheral system. The smart curve is a unique feature to Zen Lens that connects the base curve and limbal clearance curve. It allows each of these curves to be independently adjusted from one another. We will use changing the limbal clearance as an example. Point A represents the deepest point of the lens or central sagittal height. Let's say we applied this lens to a patient's eye. We are satisfied with the central sag height. However, we have insufficient clearance at the limbus, the green curve. Let's increase the limbal clearance 50 microns. Here you can see the increase of the limbal clearance. In some designs, when increasing the limbal clearance, it also secondarily increases the overall sagittal height, and then you have to redesign the central clearance to bring it back to where it was. With Zen Lens, the Smart Curve technology will do the compensation for you. In this example, it maintains the central sagittal height while making the appropriate change in the limbal clearance curve. The reverse is true as well. If the sagittal height needs a modification but you are satisfied with the limbal clearance, the Smart Curve will maintain your limbal clearance while allowing the central sagittal height to be changed. This shows you where the curves overlie the cornea. You can see that the Smart Curve is in the vaulted space over the cornea, and any changes to the Smart Curve will not impact the overall fit. The Zen Lens Scleral Lens is highly customizable. The lens parameters can be modified in microns. The central sagittal height and limbal clearance curve can be raised and lowered in 5-micron increments depending on your needs. As previously described, the Smart Curve technology allows sagittal depth changes and limbal clearance changes to be isolated and independent of one another. Lastly, the landing zone, known as the Advanced Peripheral System, can also be manipulated in 30-micron step changes. Not only can the sag height or central clearance, limbal clearance, and scleral alignment be modified independently, but the clearance over the mid-peripheral cornea can be modified by simply changing the base curve. The central sagittal height will be held constant, and mid-peripheral clearance can be increased by flattening the base curve and decreased by steepening the base curve. The consultation team can aid you with these modifications and let you know exactly how many microns each base curve change creates. The start of the landing zone on diagnostic lenses is demarcated by the engraved dots. A wider landing zone allows for even bearing on the ocular surface. Now that you know about the unique features of Zen Lens, how do you fit it? When selecting the first diagnostic lens, you must first determine the diameter, shape, and beginning sagittal depth. Remember, there are 300 micron differences in sagittal height between each diagnostic lens in a row. When selecting the diameter of Zen Lens, it is helpful to begin by measuring the horizontal visible iris diameter. If the HVID is 11.7 millimeters or less, select the 16.0 millimeter design. Anything larger, use the 17 millimeter design. The visible iris diameter can be measured using an HVID ruler with the reticle on the slit lamp or directly from corneal topography. Dots mark the starting of the scleral lens landing zone. If the dots are found to be overlying the cornea, the larger lens diameter should then be selected. The next step in selecting the first diagnostic lens is determining the shape profile. There are two separate shapes, prolate and oblate. Prolate means that the central curve is steeper than the periphery. Conversely, the oblate central base curve is flatter than the periphery, similar to a reverse geometry lens. Once the shape and diameter are determined, you now have to select a lens from that specific row. It is helpful to view the corneal profile outside of the slit lamp. Here you can determine how elevated the cornea is and choose a lens that will clear that cornea. Remember, the sagittal heights of each lens increase from left to right in a row by 300 micron steps. The first two columns are for normal to mildly elevated corneas. The third and fourth lenses in the row can be used for more moderate elevations, and the last two lenses in the row are for highly elevated corneas. Now you must prepare the lens for application. Have both the application plunger and removal plunger available. As always, wash your hands. Have plenty of paper toweling for the patient or an apron for the patient to wear. Overfill the lens with preservative-free saline. We recommend scleral fill preservative-free saline indicated for use with scleral lenses. Gently dip a fluorescein strip into the saline so the saline has plenty of fluorescein. The patient should lean or bend over so that their faces are parallel to the floor and positioned over the paper toweling or apron. You secure both eyelids widely apart and raise the lens centered over the cornea. Depending on the plunger you use, if the lens is suctioned to the plunger, you may have to squeeze the plunger to release the lens when centered over the cornea. Once the lens makes contact with the ocular surface, you can release the eyelids and pull the plunger away from the eye. Once the lens is applied, make sure it is centered over the cornea. If it is misaligned, immediately remove the lens and reapply. If the lens is well centered, look for any bubbles trapped underneath the lens. Bubbles can be uncomfortable and obscure vision. The lens should be removed and reapplied when a bubble is present. If you have to remove the lens and reapply it, you can use a corneal gas permeable lens removal plunger. Do not remove the lens from the center. Apply a moistened plunger so that the edge of the plunger is aligned to the edge of the lens and gently break the suction from the eye. We will describe a systematic way to evaluate Zen Lens by starting centrally and working your way outward. You want to begin by evaluating the apical clearance, mid-peripheral clearance, and limbal clearance. If it is satisfactory, or you know what needs to be changed, then evaluate all 4 quadrants of the landing zone. Lastly, over-refract. To get an overview of the clearance, you can evaluate the lens with low magnification and cobalt blue light. Here you are looking for apical clearance and limbal clearance. If there are any darker areas, suspect contact and evaluate further with an optic section. Using a Ratten filter can improve your evaluation of the fluorescein pattern. Here we want to use an optic section with white light and high magnification to measure the clearance over the most elevated portion of the cornea or corneal apex, the mid-peripheral cornea, and limbus. You should scan the entire cornea, superior to inferior, limbus to limbus. There are 2 ways to measure the clearance of Zen Lens over the cornea. OCT is a quick, efficient, and accurate way to measure the clearance. If you do not have an OCT, you can measure the clearance with your slit lamp. The center thickness of Zen Lens is 350 microns. Compare the clearance, which is the fluorescein band, to the center thickness of the lens. Make sure the beam is 45 degrees. Otherwise, the clearance estimation may be over or underestimated. If, however, there is corneal contact, select a deeper lens in the fitting set. To simplify the starting point for clearance with Zen Lens, aim for an initial clearance of 350 microns or a 1-to-1 relationship of the clearance to the center thickness. Having 350 microns initially builds in extra clearance for settling. You can always adjust more or less after you see the patient when the lens has fully settled. Shown here are 2 different clearances on the same cornea. On the left, the clearance is narrower than the center thickness and was measured to be 200 microns. Putting the next deeper lens in the set now increases the overall clearance of 500 microns. In this example, you have 2 options. Since the first lens was not touching, you can simply add 150 microns of sagittal height to your order, or put on a second diagnostic lens and subtract 150 microns of clearance in your order. When you change the sagittal depth, no other parameters are changed. Zen Lens should clear the cornea and limbus. When viewing the cornea and limbus with diffuse cobalt blue light, assess how many quadrants of touch are present, if any. For every quadrant of touch, increase the limbal clearance 50 microns. If all 4 quadrants are bearing on the limbus, consider increasing the overall diameter. The consultation team is happy to help you design a lens based on your observations. Once you are satisfied with the clearance or know what you plan to change, you next have to evaluate the landing zone of the lens. The Advanced Peripheral System, or APS, is the landing zone of Zen Lens. Z1 through Z24 have standard peripheries. That means that the landing zone is symmetric 360 degrees around, and that the landing zone is the same for each diagnostic lens except the last column of lenses. The APS can be flattened 20 steps and steepened 10 steps, and each step is 30 microns. Lastly, the APS can be designed toric or having 2 independent peripheral curves. To aid your determination of toric peripheral curves, there are toric diagnostic lenses in the last column of the set. The peripheries of these lenses are flat 3 in one meridian and steep 3 in the opposite meridian. A tight landing zone of a scleral lens will cause blanching or compression of the conjunctival vessels. Zen Lens step changes are quite small, so 3 steps, or a total of 90 microns, represents a clinically significant change. If a lens is tight, you will see blanching in extreme gaze. If the blanching goes away in primary gaze, only flatten or loosen the lens 2 to 3 steps, or 60 to 90 microns. However, if the blanching is still present in primary gaze, then flatten the landing zone by more steps. The landing zone may be too loose or flat on the sclera. Utilizing fluorescein will help view the location of the APS that is too loose. In this example, you can see that the fluorescein is coming in from the top and the bottom, which is indicative of a toric pattern. The lens can be designed with a steeper APS along the vertical meridian, while the horizontal meridian can remain unchanged. This is an example of a toric periphery. So what exactly is a toric periphery or toric APS? Basically, the lens can be divided in 2 meridians 90 degrees apart, where the landing zone can be manipulated in each meridian independently from one another. You know you need toric peripheral curves or toric APS when you do not see the same appearance of the landing zone 360 degrees around. Here, the vertical meridian shows more blanching than the horizontal meridian. Lenses with toric peripheries are in the last column of the diagnostic set and have pink labels. This column has the exact same parameters as the 5th column, except that the periphery is flat 3, steep 3. The toric diagnostic lens has the flat 3 meridian labeled with hash lines near the limbal zone. Once you apply the lens, wait at least a minute to evaluate the rotation of the lens. The toric APS diagnostic lenses have deep sagittal heights to accommodate a wide variety of corneal depths. Therefore, determine the optimal clearance and over-refract with the standard lens first. If you suspect the sclera may be toric, then apply the toric APS diagnostic lens from the same row. Once you apply the lens, ignore the clearance and just evaluate the landing zone. The flat and steep meridians will align with the toric landing zone, even though the flat 3 and steep 3 may not be the final ordered parameters. If you are confused, document the rotation of the lens and determine if that meridian needs to be ordered flatter or steeper, and then look at the opposite meridian and determine if that needs adjustment. When in doubt, the consultation team is happy to help you. Make sure you are clear which meridian is closest to the horizontal and vertical to allow for proper marking of the ordered lens. Just like any gas-permeable diagnostic fitting, determine the power with a spherocylindrical over-refraction. If you detect cylinder, the final lens will have to be stabilized either with dual elliptical stabilization, which is essentially a dual thin zone, or stabilize it with toric peripheral curves. If you suspect the landing zone needs toricity, here it is important for you to apply the toric diagnostic lens to determine the rotation of the lens. Just like a soft toric lens, the rotation has implication on the final power of the lens. Dual elliptical stabilization is used when the landing zone is rotationally symmetric. Microvolt Technology is a vaulting feature of Zen Lens that can help bridge over a peripheral elevation like a pinguecula or an internal elevation like a nodule. Consultation can help design a lens with this feature. The basics to ordering a Zen Lens Scleral Lens are as follows: the diagnostic lens that you used for your evaluation, central sag, limbal clearance, APS, over-refraction, material, and color. Remember, all over-refraction powers greater than or equal to 4 diopters require vertexing. If you do not vertex, let the consultation team know when placing your order. There are a wide variety of parameters that can help you accommodate the needs of your patients. In summary, Zen Lens is a versatile fitting set that can accommodate a wide variety of corneas of different shapes, diameters, and depths. Optical toricity can correct residual astigmatism, while landing zone toricity can stabilize the fit. Lastly, a microvolt can troubleshoot peripheral and central elevations. Consultation can assist you with any questions or troubleshooting needs that you may have.